Well, staying in the UK, regulators there have approved Merck's antiviral pill to treat COVID-19. It is the first oral drug to pass scientific checks and is being hailed as a major breakthrough in the fight back against the pandemic. The pill will be used to treat patients with mild to moderate symptoms. It's been shown to halve the rate of hospital admissions and death. Let's bring in Bharat Pankhania. He's a senior clinical lecturer at the University of Exeter Medical School. He joins us from Bath in the UK. Bharat Pankhania, welcome to the News Hour. How does the pill do what it does?
So this pill interferes with the virus's replication mechanisms, and by interfering with how it reproduces, it makes it make many mistakes. And by making many mistakes, it stops it from being able to reproduce properly. And that's how it works.
Why is it only to be used in people with mild to moderate symptoms? I mean, people who say are presenting looking like they've got a really bad dose of the flu, but they've actually got COVID-19.
Yes, so the two hurdles that we have to get across is make an accurate diagnosis, make the diagnosis early, and then treat early. So those are really important hurdles. So why it has to be taken early is because at that early point, the viral load is low and it hasn't set into motion a cascade of immunological responses that make you very ill and end up in hospital, and some people die. So the earlier you get in, the smaller the viral load, the smaller the number of virus amount that have to be neutralized, and the better it works. As soon as your viral load is very high, of course, other triggers have happened, and then the medication does not work as well.
Does this mean that we've all got to get used to strengthening or growing calls to be tested on a regular basis? For example, if one gets the cold or the flu, or one assumes it's just the cold or the flu, one should very much be aware, actually, it might be coronavirus. Therefore, I've got to get tested. I can't just ride the wave and take Nurofen or paracetamol and hope it'll go away.
Well, actually, a better strategy than regular testing is to be first and foremost be immunized, because immunization is prevention, and it is better to prevent illness than to take the risk of, I have got a pill that may make me better. So the first strategy is immunize. Second strategy is don't get infected, wear a good quality mask. Third strategy, if you've got signs and symptoms, of course, you must eliminate, could this be COVID, and don't take it to your friends and colleagues at work. And if this is early on in your infection and you have got risk factors like diabetes, heart disease, high blood pressure, then you will benefit only if you take the pill early in your infection.
If this pill is good for people who are little sick or medium sick, not big sick, why not just give them more pills as they are getting big sick?
No, it won't work like that. First and foremost, you've got to identify that this is an infection, and then only do you take it. And you can't just give these pills and hope that we've caught a infection against which it will work. So really, you have to diagnose it and then take it. But there is a delay in between doing all those things.
Can I just ask you one final brief question, sir? What's your reading of the figures for the infection rates across Europe and in the UK? The numbers seem, depressingly, to be going in precisely the wrong direction.
Yes, so the United Kingdom picture is not nice. It's not rosy at all. 40,000 new cases. I'm sure the case numbers is a lot higher than that. And we have at least 200 deaths a day. It's unacceptable. And now is the time to bring in measured infection control measures, like avoid crowds, get your immunization, wear your mask, wear it properly.
OK, we'll leave it there. Bharat Pankhania, thank you so much for joining us from Bath there in the UK.
Thank you.